All right. Wow, welcome everyone. This is a very exciting day. I want to just take a very brief moment to welcome everyone to this really special seminar. Welcome to our students and faculty and staff and guests in our audience, and a warm welcome to all of our online participants as well. For those of you that don't know me, I'm Michele Decker. I'm a faculty member professor in this department, and really have the pleasure of convening this session for us for today. And just absolutely thrilled to be able to bring this incredible panel of speakers. Our session today is focused on global women's health and gender equity, and really talking about that evidence to action process, really convening this incredible leadership panel, really centered around advancing Sustainable Development Goal 5 around gender equity and empowerment for women and girls globally, and right here in Baltimore as well. And we have what I would say is a true dream team of leaders in this space from across institutions, all in leadership roles in global women's health and gender equity in their various disciplinary homes and roles. And some of whom are taking on even new leadership roles, which is very exciting. So I am very pleased to be able to introduce our panel for today, Feinian Chen, who is professor of sociology right here at Johns Hopkins and is our new director of the Hopkins Population Center. Very warm welcome and thrilled to have you here with us today. We also have with us Anita Raj, professor at the Tulane School of Public Health and the new executive director for the Newcomb Institute. Again, stepping into this space to really advance women's health and gender equity. So we are thrilled to have you with us as well. And then we also today with us have Jay Silverman, a renowned leader in gender-based violence prevention and response in the interface with reproductive health. Joining us from University of California, San Diego in the Center for Gender Equity and Health. And we are thrilled to have you. Thank you. And as if the celebration was not yet enough, this is actually also kicking off. Oops, hang on. Got it. I'm with it on the recording. Excuse me. Sylvia, I'm doing something wrong up here. What's going on? Okay. You'd think I could do this by now. Really. So I'm absolutely thrilled. As many of you know, we are launching a new Center for Global Women's Health and Gender Equity here at Johns Hopkins. And we are in the midst of a launch month of celebrations. This is one of our events. We're also going to have a chance to hear about gender and humanitarian action featuring Rosemary Morgan and others in international health. Feinian's got a session coming up later in the month on adolescent gender belief. And we'd like to invite you warmly to our launch event right here at the school, which is about a month from now, October 18th. And in Feinstein Hall, and it's going to be really a celebration of all of the global health and gender equity work happening at the school and the university. So stay tuned for more details on that. And we're thrilled to really be pulling this leadership panel today to kick this event series off. So our format today, we're going to have a chance to hear from each of our speakers, and we've allowed quite a bit of time for, we've called it kind of like a panel discussion at the end, knowing that there was a lot of discussion, questions from students and faculty, and wanting to really kick off really a nice, engaging format for our noon seminars so that we can really invigorate all of the voices around this table. So without further ado, I want to invite Dr. Chen to come up and kick us off with the focus on adolescent gender beliefs. Thank you.
Thank you so much, Michele, and thank you so much for coming this. I'm so honored to be here for this great event, and also to get to see my old friends, Anita and Jay and all that, and seeing everybody. And it's a great excuse always to come to the East Baltimore campus. So this is great, thank you. So today I'm only, I know I'm allowed to speak for about 10 to 12 minutes. So, oops, did I mess up? Okay, great. So sorry. So I'm going to talk about adolescent gender beliefs in India and maternal empowerment. So this is a shorter version of the talk, and I'm going to give a longer version of the talk next week at the Hopkins Population Center for an hour. So if I miss anything and all that, consider this like advertisement. If you would like to know more, please come to the next one. We will have a reception following my talk next week, next Friday at 2 o'clock, as Michele mentioned. So today, I would like to acknowledge that this is actually part of a larger project on measurement of women's empowerment and the consequences of women's empowerment in India and the global South. And it was funded by Hewlett. And I'm also currently writing another grant on women's empowerment and the health trajectory over the life course in India. And this is very much work in progress, so I'd love to hear all your comments and advice for us. And I would like to also acknowledge my collaborator on this, Hope Shuyan, a PhD candidate from University of Maryland, College Park. So here, this is the goal today, right? We're talking about, the SDG, right? Achieve gender inequality and empower all women and girls. This is with the goal that was put forward by UN back in 2015, right, with a goal of achieving this by 2030. And we're more than halfway through, and obviously we're not quite there yet. We did make a lot of progress, but the same time, I think it's still safe to say gender inequality remains quite pervasive. And that's particularly true in society where the traditional gender beliefs have deep historical roots, and these societies' gender norms, they're even more resistant to changes than other tangible structural barrier. And we know norms, they do not change overnight, right? They often lag behind other social forces. And that is why it is crucial to understand it from a young age. So it's crucial to cultivate egalitarian gender beliefs among children, right? We know that this is the formative years, the adolescence, and then because of they're influenced by the peers, right? The community, the schools, and also importantly, their parents, right? Through socialization and all that. So we know this early on, the cultivation of egalitarian beliefs could be particularly important for girls, right? And to inspire higher educational and occupational aspirations, and as a result, this could advance empowerment for the rest of their lives. So it's a very important topic. So what we know so far, we know that peers matters, community matters, and all that. But there's also an extensive literature in social science devoted to the intergenerational transmission of gender beliefs, right? How the parents, they could transmit their beliefs, gender beliefs and attitudes to their children. And there is an extensive literature on that, particularly in the US and the Western country. You don't see a whole lot of that in the developing world. In the global South, we do have, quite an extensive literature on maternal empowerment and how it in itself it's important for gender inequality, but at the same time we know there's a lot of literature on the positive influence of that on children's health, nutrition, and educational outcomes. And I think everybody in this room is very well aware of that. But then very little attention has been paid to how this maternal empowerment could affect their children's gender beliefs. So this is exactly the research question that we are trying to answer that in this paper. I think we have very modest goal. We just want to see, whether we have a yes or no answer to that. Based on the existing literature in the other setting, I think, we should expect a yes, right? Given that, that there is, parents could be important agent of socialization and all of that. But at the same time, well, maybe not so much, right? I already said that in societies, for example, like India, gender scripts remain highly restrictive for women. So in a society like that, where there's strong normative pressure, right, for women kind of, to, come as a secondary status and all of that, maybe the mother's role, they cannot do very much to deviate their children's path one way or the other. And also you could argue that, in India, we do know that the rapid education expansion and, with, in terms of literacy rate and all that, there has been big improvement in recent years. So you could say that schools and peers maybe are more relevant than family members. So that's a maybe not the answer. And there's also the third point, which is like, there's also complexity in terms of the conceptualization and operationalization of women's empowerment. I do not want to steal Anita's thunder later. I'm sure she's going to talk about Emerge later on, which I learned so much about the measurement of women's empowerment. But it's safe to say, at least this is an extremely complex concept, right? We know that it evolves over time. It involves a process of change. It is about this interrelatedness between, resources, agencies, and achievement. And it's known also, it's kind of notoriously known for its fuzziness of the concept. And in the context of India, there's also additional complexity in that we know that these different markers of employment, oftentimes they do not move in the same direction, right? For example, we know that education and work, they have a U-shaped relationship. And so there's, just safe to say a lot of complexity involved. So in this particular paper, we would like to, kind of try to tackle this. And we're starting with the typology, right? We think that we're doing it a little differently from the existing literature in that, which is traditionally kind of a variable centered approach, right? You look at the indicators of, agency, decision-making, mobility, and all that sort of things. We're still using those indicators, but we're taking a person-centered approach in that we're classifying these different mothers in different groups. So it's not, used by using a variable in the regression model, but which we're conceiving empowerment kind of as a latent concept, right? And then, underlined by these different dimensions. So this is one thing that we're hoping that we're moving the literature forward a little bit. And then secondly, also we want to bridge the literature on women's empowerment and the intergenerational transmission of gender beliefs. And then we're focusing on what women do rather than what they say in the context of India. So we're not going to look at mothers' gender beliefs. We wish we have that data, not yet, not in this particular wave, but we're going to focus on, what they do. And I'm going to talk about that in a little bit. We're also going to test the hypothesis that whether this effect differ for girls and boys. In the literature, we know that their hypothesis about the same sex parents tend to matter more in socialization and all that. So we'll test that. We will also address, of course, the potential endogeneity issue in this. We know that women's empowerment and their children's gender beliefs could be jointly determined by a lot of factors, that could be captured by in the family context, the community context, and all that. So we try to use a community level fixed effect models and propensity score weighting analysis to adjust all of that. So data part, we're using the Indian Human Development Survey, and this is a nationally representative and longitudinal survey of over 40,000 households. The survey started back in 2004, and now we're in the third wave of it. And as we speak, it's currently in the field, and we're hoping that the study, the data collection part will wrap up in next year. But here, for this particular paper, we're just only using one wave of it, the second wave, the 2011 to 12. And the reason we're just using one wave is because this is the part with the youth questionnaire that surveyed adolescents 15 to 18 years old. So our sample analysis is about, a little short of 9,000 adolescents. And so dependent variable, gender beliefs, I'm not going to read out the question loud just to save time, but as you can see, it covers a range of different areas, including, their attitude about, some preference, about gender division, labor, marriage, so on and so forth. So those are the 5 questions we're using to construct. And then here is just some descriptive statistic that higher the number suggesting more egalitarian gender beliefs. And as you can see, certainly we do see girls have higher, more egalitarian view than boys. Education also makes a difference bivariately. Work, in a different direction, and then certainly their own experience matter a bit working on that. And then of course you would see that caste, religion, and residential area makes a difference. Moving forward, we're first starting off with the latent class analysis, and this is a data-driven approach. We're going to use 5 empowerment indicators, which I'm going to show you in the next slides. And basically, this approach is going to classify women into different classes based on these different indicators. It will generate this so-called item response probability about how high they are, in terms of the probability of belonging to each different class. And then the analysis basically starts with just one class and then add to 2, 3, 4, and 5 and 6. And we stop at 6 because the model fit statistic just look the best at that point. And then we'll follow up with a regression analysis to use this as a key predictor to predict the gender beliefs. And then we're also adjusting for propensity score weighting for endogeneity and all that. So just, let me walk you through this analysis from the latent class. As you can see, these are the 5 indicators we're using about education, work, the decision-making power, and about 7 items, their mobility, which is about their freedom to going outside the household, in different location and all that. We're also including a number of organizations women belong to, including self-care, help group, political organizing here, and so forth. So again, higher numbers of indicating higher employment. And then based on the class, as you can see, these are based on the item response probability. We're naming them basically according to the characteristics of these different women. So as you can see here, the first class, we're calling them educated home workers. By the way, we're definitely taking advice on how to name these. We came up with this, we're not too happy with them, but if you have some suggestions, we would love to hear that. So this is the group we're naming them educated homework because this is the group with the highest probability in terms of receiving education rates, which definitely stand out compared with the rest. And also, but they have, very low probability of working, as you can see. And then also they have low mobility, no participation in women's organization at all. And the second group, which we named this group as the proactive workers, their education level is not high, as high compared with class 1, but as you can see, they really stand out in terms of the employment categories. And at the same time, I'm so sorry again. What stands out most is that they have a very high average in terms of participating in these local organizations. And that's why we named them proactive. And then the average in power, they're just average across all the indicators for a lack of better naming strategy. And then the next one is the high mobility group. And then this is the group of mother that, again, definitely stand out among the rest in terms of how mobile they are compared with the rest of the group. And then the next group we have is the low agency group. And this is the group with the lowest average level of decision-making power in the household. And next one, they also, low in terms of employment. And then the final category, we call this group the underprivileged worker, in the sense that, education level is the lower compared with the rest of the group. And this is a group also with very limited mobility and all of that. So let me quickly, I know I'm limited, oh my God. Time-wise, okay. So this is the result, and I'm not going to show you the table and all that. And this is after we control for everything, including the community level, the fixed effect, and also adjusting for propensity weighting and all that. And the coefficient definitely changed, attenuated some after we did all these controls and the adjustment and all that. And I'm showing this to you by girls and boys. And as you can see, there is a big difference. When you look at the boys, which is these in the lighter blue color there, women's empowerment, you can see they tend not to matter as much. The only group that stands out is the underprivileged worker, the mothers who are in that group. And those boys, actually, they tend to have more egalitarian score, potentially because, this is a, like I said, lower in terms of the family SES and all that. There could be less of a gender division of labor and at home because of lack of resources and all of that. I also want to call your attention to girls, which is this is a group that we're really interested in. And what stands out here is this group we're calling the proactive workers group. And then they have these girls have the highest or the most egalitarian gender beliefs. In contrast, this educated home maker group, where the mothers are more educated than the rest, but then they don't score high on other employment group, then, actually this group is not statistically different from the other groups. So I know I'm kind of running out of time. So let me wrap up in conclusion and discussion. So from this, I hope you can see that, I hope this strategy is paying off in some way, that we are capturing this multidimensionality of women's empowerment, and then there's tremendous unevenness there. So as I said earlier, in the Western literature, you definitely see maternal education and employment are really important predictors of children's gender beliefs. But in the Indian context, we find the effects are much more nuanced, right? The girls with who are the educated homemakers, they're not the most egalitarian group at all. But in contrast, girls with the mothers who are proactive workers are most likely to have the highest level of gender egalitarian beliefs. And we think this is because this is a group with, higher level of employment. But on top of that, these are the women are mobilizing their resources, drawing from their social network for support and all that. So I would call that this is a group that's high on the instrumental side of agency of women's empowerment. And also, it's very interesting that we're finding that it does matter more for girls than boys. And but having said all that, I do want to acknowledge that I didn't present the effect, on the community and all that. In comparison, maternal employment matters, but it's still the effect tend to be modest. We still have, from the analysis, can see that the community context, the norm, and the schools, they're playing very important roles. But even having said that, we do think that, with mothers, active roles and all that, they're setting, good role model example for their daughters, and but by mobilizing more of their agency outside the home, they're not only doing good for themselves, but also setting inspiration examples for their girls. And as we said, because teenage years, adolescence is such an important period of time, kind of to set the stage for the rest of the life course, we think this is really important for us to focus on this particular period of time of that. And then it does have strong policy implication in terms of advancing the mother's empowerment. As a result, we're also going to pay off seeing the result for the generations of the girls to come later. So let me end here. So sorry to be rushing a little bit. Thank you.
Thank you so much. So much to think about, and appreciating the methods and the gender stratification on this. So I want to invite Jay Silverman. We're going to pivot to intervention work on arches. And thank you so much. Smorgasbord of exciting work today.
All right. Let's see if I can make this go. Okay. So a lot of people, I think, in this room, at least a bunch of you, are working on reproductive coercion and other forms of gender-based violence. So this will be of interest. I want to say that the program we're talking about here, ARCHES, which stands for Addressing Reproductive Coercion in Health Settings, came from the work that I did with Dr. Decker and Elizabeth Miller many years ago. So it's a longer list. You should certainly be on there. Okay, so for people who are less familiar with reproductive coercion, it's a form of gender-based violence that's mostly comprised of male partners, but also family members, behaviors that reduce reproductive autonomy by doing a number of things, including interfering with contraceptive access or use, or pregnancy decisions. Shannon Wood, who's in here, I know did a bunch of work, right, very recently on this in terms of a multi-country study, and there's been a number of smaller national studies on this, but there's a range of prevalence certainly across different countries, but it is certainly consistently shown to be associated with intimate partner violence. Forms of reproductive coercion, contraceptive sabotage, which is really basically once a woman has contraception, doing things to make it very difficult for her to use it or to make it ineffective, threats related to pregnancy. So threats of abandonment, economic consequences, violence if she does not become pregnant. And then pregnancy and abortion coercion, meaning it's when she's become pregnant, coercion for her to remain pregnant when she wants to terminate the pregnancy, or to terminate a pregnancy that she wants to keep. Okay, I'm going to talk about what ARCHES is, and there's sort of three basic operating elements that we've really distilled in this work. One is the idea of universal rights-based counseling. So as opposed to screening for IPV, and then if people say yes, they get some information, it's the idea that everybody as part of, and this is, I should say this is part of family planning counseling, contraceptive counseling, that is part of that, the standard of care. There's a discussion around reproductive coercion, that this is something that affects many women and girls, and that it's part of the consideration for family planning choice. And then often based on that discussion, there's we call it sort of an, the next thing, really an opportunity to disclose as opposed to screening. Because screening, in the clinical context means like it's the provider's job to find out, right? I'm going to identify you. And really, we don't want to, take away women's agency here. There are so many reasons we know why women and girls would choose not to disclose, very good reasons, but it's an opportunity to disclose. And then of course, upon disclosure, validating response and supportive linkages. Rights-based palm-sized booklet. So again, this sort of gets back to the universal, where women and girls may have said nothing. They may be having, experiencing it in part of life. They probably know what other people are having these experiences and reproductive coercion, that it's, made to be very small, fit in a shoe, fit in a bra, that it is, that sort of, it's a mini, synopsis about the rights to use FP, different methods that can be used privately, and local intimate partner violence services, so that even if she said nothing at all, she's walking away with this information, and which turned out to be a much more potent piece of this, I think, than we realized. I'm going to talk very quickly about two controlled trials that were done. So, and I should make sure to mention that the trial in Bangladesh was led by Erin Pearson, who is an alum of this program, and I'm very lucky to get to work with her. And of course, she was a mentee of Michelle's. So I won't go into this too much, but the different design, but 6 clinics in both cases. The important piece here with Bangladesh, that these were abortion clinics as opposed to family planning clinics in Nairobi. Similar longitudinal designs, and I'm going to present both intent to treat and as treated analyses, so people understand intent to treat, meaning, okay, as you laid it out, in the study, you're in this clinic, and so you're supposed to be getting, this intervention, or you're in this clinic, you're supposed to not be. Well, there are different things happen, often with people not getting the intervention that you plan. And as treated means, did you actually get this or not? Okay. So very quickly, disclosure, which is, again, say it's not the goal, but you want people to feel safe, that this is somebody that they can trust. Often that's happening through this discussion. Like, I understand these things are happening to a lot of people, and it's a big problem, right? That discussion around reproductive coercion, around partner violence. So when there is an opportunity to disclose, particularly in Kenya, we have very, very high rates of disclosure for both RC and IPV. So this 100% is the people who reported on a survey that they had any of these experiences. So over 80% for both Kenya and Bangladesh disclosed RC, and almost that amount, or the same amount, disclosed IPV in Kenya, and a little bit less, but still the majority in Bangladesh, and that's unusual. If you look at IPV sort of screening studies, those numbers tend to be quite low. Okay, I'm going to go through some results here. There were some small effects on modern FP use, only really an intent to treat in Kenya, but they're in both analyses for Bangladesh. Again, remembering Bangladesh these are abortion clients as opposed to family planning clients. Incident pregnancy was reduced in both groups. So the idea is not to try to stop people from getting pregnant, but the idea is that these are women coming in for abortion or family planning. They're coming in to prevent pregnancy. And then, although we're really underpowered to look at this, some marginal effects in Kenya around reduced unintended pregnancy. Excitingly, in both of these trials, we saw reductions in physical IPV. And sexual IPV, a little more complex in that, although there were significant reductions over time in the intervention group, the pink line, we saw major reductions in reporting among the control group, which is really quite puzzling. And in fact, we saw, Michele was talking about test-retest reliability earlier. And what we found was that when women were recruited in the waiting room and you asked them about sexual violence, if they then went on to get the Arches intervention, they reported more. And if they went and got the control and they basically were asked these same questions, right, half an hour, 45 minutes later, they reported less. And so we had this strange biasing, which definitely obviously makes it challenging to look at effects of a trial. At follow-up in the Kenya trial, we asked about people leaving a relationship and why they left a relationship, and women reporting leaving a relationship because they said it was an unhealthy one was greater in the Arches group. So in terms of knowledge of IPV services, it was increased in both Kenya and Bangladesh. And the majority of people in both of these trials reported sharing the information that they got in that booklet with other people. In Kenya, it was about 90%. And one thing that was really surprising, but I think important, is that it's in Kenya, a third of the women reported sharing that information with their partner, and that being instrumental in a reduction in violence in their relationship, basically saying, this is proof that like this is not okay, and that there are people, there are structures who will help me if you keep doing this. So it really sort of broke the sense of isolation for them, and for some partners, being put on that level of notice was enough to reduce their violence. That's obviously not going to work in all cases, and I'm sure, you know, in those cases, probably women were less likely to show it to their partner, but it was it turned out to be a very important tool. This is a quote from a client who received the Arches intervention. If a man insists on having a child, you can use a method secretly for some time and stop using when you feel you're ready to have a baby. It's important to me because the doctor gave me knowledge I learned when I could use that knowledge. So really what we talk about is, right, it's this reproductive empowerment. And though there's many different ways to measure that. Okay, how am I on time? 1 minute? Okay, that's what this I'm saying. Okay, so instead of then taking the minute to just repeat this, what I wanted to say, and I'm sorry I didn't have a slide on this, is that we in Kenya had people from the Ministry of Health involved in adapting this program, right? This program was first developed, myself, Michele, Elizabeth Miller, others here in the US. And we had to do a major adaptation process. It was quite participatory, you know, in terms of practitioners, but we also had people from the Ministry of Health involved. And although in reality, they didn't have much to say when they were sitting at that table, they kept coming. And at the end of the trial, they said, well, we should be doing this. And it took us a while, but a couple of years ago, we finally got funding from the Bill and Melinda Gates Foundation to work with the Ministry of Health in Kenya to scale the program up nationally in public health facilities. So it's a very challenging process. We're still in the midst of it, but it's, you know, again, in what you have to suffer a great deal of imperfection, shall we say, as you go along, but it's obviously tremendously gratifying to see, you know, it's what our goal is in public health, right, is to try to affect population health. So it's a nice example of us moving right from evidence to action. And I will leave it there. Thank you very much.
Thank you so much. This is so exciting. We are going to turn next to Dr. Anita Raj and hear about, I think, taking us back on more of a measurement journey as well. And thank you.
Okay, so mine's a little bit different, but I really want to say that I'm just really honored to get to be here. This is the Center for Global Women's Health and Gender Equity is just, I think, a really important addition to Hopkins, which is a very illustrious institution, as I'm sure I don't have to tell you all. And I'm really, really proud to be here and very honored that Michele picked us to help be part of her soft launch for this year, or repeated launch for this year of her new center. All right, so I'm from Newcomb Institute at Tulane. Lots of slides. I'm going to tell you a little bit about Emerge, which is it's an open access platform. We were funded by the Bill and Melinda Gates Foundation. They had started an initiative about, 7 years ago called Bringing Women and Girls to the Center of Development. And people were very, very interested. Many of you may know Amnila Kabir. She had started work in development econ and was speaking about empowerment, but there were other fields where, community empowerment was getting built up by people like Silverman, Freire in education. These were principles that were really, really touted as supporting how we can advance the work we do to ensure that our public health practices or public health policies are not, in fact, coercive or controlling, but actually are supportive of a process that is participatory and empowering. And, you know, commending the people that you've already gotten to hear from, so certainly India's India Human Development Survey, the work with reproductive coercion, has consistently been engaged within a participatory process to bring these kinds of measures to the forefront so that they could actually look to see if empowerment was, in fact, the process through which we were seeing the kind of public health effects we wanted to see or development effects we wanted to see. But one of the things that was going on about the time, let's say 7, 8 years ago, I was invited to do a talk, and one of the things I brought up was that I'm very concerned because people don't use the same measures. So there's a few issues about that. Is that there is a science to measurement. There is a way that we can undertake a rigorous process to understand the concepts of empowerment, to think about what empowerment means, to contextualize it, and to be able to assess it in surveys. And people have been learning through that, and yet what everybody is doing is reinventing the wheel every time they put a survey into the field. And one of the things people told me back was, well, that's because not everybody has access to your academic libraries from the United States. So we thought, all right, so I think there are a couple of things going on. One is we need to get open access. Another is we need to actually build out the measures across constructs of empowerment. And the third is that we really need to be building measurement scholars from across the world. And some of those are actually in this room. They preceded Emerge in doing this work. So, you know, why is this essential? Because women and girls are viewed as drivers. The strength and well-being of women and girls are considered drivers of development, and we've seen that in the SDGs. We really think that men and boys, people beyond the gender binary, are part of understanding those issues and still believe in the centrality of women and girls and how we think about them. So this has a lot of information in it. But when we started, about 80% of gender equality and empowerment measure, the kind of indicators that the SDGs wanted to advance, there was no measure out there. And we wanted to obviously increase the development and use of these kind of measures that happened. So created the Emerge virtual platform. Since that time, I think we're getting pretty close to 1,000 measures online now. These are gender empowerment measures. I can thank the 3 people who spoke earlier because they've helped create some of these measures. We get about 1,000 weekly visitors. About a third are from low and middle income countries. We'd love to see that come up because we do want to see an increased support for local researchers to do local work. And we created ready-to-use modules in a variety of areas. We've been working on our social media presence and networking. I am not the best at those things, but being here today, if I get one thing to you all, it's, can you look at the Emerge website? Can you become a registered user? Can you look and see the measures that are there? Can you encourage others to do it? Because the website does offer you best evidence measures, but the utility of this website is only there if it is actually used. So the website is down here, emerge.ucsd.edu. And yes, I will take a moment for you to look at the website on your phones. Sure, go ahead. As you take your phones out and look at the website, you can see that there's different ways to identify and find the measures. Please consider being a registered user. It helps us understand what user needs are, who are the users that we have. Please share them on your social media. But you can see that we really have worked to try to understand, to align the measures by the dimension. There's a series of dimensions to understand what's been tested by country. We do have other indicators, things like, I definitely see you going on your websites. Thank you so much. So, and then, you know, you can type in a keyword. So this allows you, so populations, like, are you working with adolescents? This helps you just get on there and quick and easy as we can, help you get the measures you need. We do have certain standards that we work to adhere to in terms of the measures that we include on there. So you can see on the measure page components that there's a description, there's how the item response, you can just scrape it. You can just like go through, cut and paste and throw it in. We used to put it as a downloadable Excel document, but it was a mess because nobody makes their questions the same or the response patterns the same. So we realized it was just better for you all to see it in a very flat way that was easier for you to be able to scrape. It's got your citation, it's got a psychometric score calculation, it's got information on Google Scholar citation frequency, which is really just going to the Google Scholar document, and then the demographics that we had the testing on. The scoring procedure, we think one of the most important things we've hopefully done to contribute to the field is one, to add discourse. I didn't mention it, but there is a emerged theoretical framework. This is in the process of it's under review for publication, but it's fully available on the website as in terms of the description of how we think about empowerment from a multidisciplinary perspective on what empowerment is in terms of constructs, critical consciousness, consciousness of choice, agency, the components of agency, goal setting, agency, and self-determined or collectively determined goal reach. So I'm just going to bring up, this is the reproductive coercion measure for Niger. If you were to go on and you were to look at reproductive coercion measures, you would see it for a variety. You would also notice that Dr. Decker and Dr. Silverman are on many of these. Can I just point out, because they don't ever get, this is not said often enough. Many people use the term reproductive coercion, and people have clarity on that concept. These two people, and with Liz Miller, they created that term. They did it exactly as you said. This came from qualitative evidence. They then worked to create a quantitative measure. They tested that quantitative measure through survey research. They then started to utilize it in different contexts, built intervention work around it so that you could see the kind of changes you saw. That is the beauty of measurement. If you know there's a problem, you can seek to change that problem. And I don't want to, I see Feinian answering the Indian Human Development Survey, the issues of child marriage, the idea of coercion in marriage, so many aspects that they had thought of and worked in these surveys. This is how we have the knowledge we have. So concept is really important. And I know we lose a lot when we narrow it down to a measurable construct, but I cannot tell you, and I cannot speak enough about how this creates the indicators at national scale to see if we're having impact, how they on the ground are able to do it. And I recognize that context matters, but also understanding national level indicators that are comparable in nature is so important. So really kudos. We can put these together, but we couldn't do it without the people that come up with these constructs and clarify them and then measure them and use the science to create change on these. So I just want to highlight for you how these changes have looked. So you can just go across psychological empowerment, social empowerment, women's economic empowerment, education. That's just this last so that you can see where the columns, what they mean. Legal empowerment, political empowerment, household relationships, environment, gender-based violence, health, but we've separated out maternal, neonatal, and child health, and sexual and reproductive health. I want to highlight for you how much has happened in the last 7 years. When we have clarity on the value of science, and when we have clarity on concept and construct, and we have value for those things, the measurement world opens up to us. But I also want to highlight that you can look at the difference between maternal health and sexual and reproductive health. We are seriously lagging behind. So Feinian, thank you for a maternal empowerment measure. And I'm like, I have not seen this presentation before, but I was like, proactive, what was it called? Proactive worker. And I was like, I'm like really wanting to read this paper now, because this is the way we can have understanding. And so this will end up going into our maternal health feature. But you can also see, like, we want to do more on gender and environment. where are our measures to do that? So I hope this particular slide helps you understand where there is opportunity to create change. Do you see psychological and social empowerment? So I came of age as a researcher in the 90s, big push in that era with psych, and in no small part because psychometrics came out of psychology. So we had a lot of measures, but you can see now in development and health, this is where we're pushing forward, and I'm probably overusing my time. So these are some lovely quotes, including one by Melinda Gates. Little second to just see that we are working to shape the field, but in collaboration. One of the things I'm really proud of is it lives virtually. This is completely accessible, but it also lives virtually. No one really owns it. I do control it. I like that. But what we do have, and we haven't even had a chance to look at yet, is on the back end, we actually we keep information on who's publishing the data so that we can get a better idea. These are some of the amplifications of work. I have a feeling you might see some people in the room authoring some of this. And I want to highlight this piece to you, which is we've now created, just in the last 6 months, an academic toolkit so that people can actually use the Emerge platform as a teaching tool. And so I really want to encourage you to use that. They did also create YouTube videos for it. So please, I hope you will use it again and share it. And if you don't like something, we may not change it for you. We may not be able to, but we do take feedback, especially if you're a registered user. So we have some recommended readings, and I know I'm going through this quickly, but it's, this is really a little bit to introduce you about Emerge, but my hope is just to sort of reinforce the value of the new center here at Hopkins, and what goes into the kind of studies you just saw presented. Methodologies are really central of the strength of the work that's getting produced, and too often for too long, and much less than it used to be, this was viewed as fuzzy or soft or, not rigorous. And I think that what you see in these last 5 years in particular is incredible scientific rigor coming into the field. And I think I congratulate you on being at a wonderful place to be able to get trained and be able to engage in the rigor at the new center. Thank you.
Thank you so much. That was great. What a perfect ending point for the panel portion. So let me grab so our online folks can hear. That was a really thank you. I just want to give a round of applause for our speakers as our chairs are coming in. Wow. That is all about science and our ability to use evidence to advance the goals that we have in gender equity and global women's health. We can't do it only on passion. We have to have the metrics and the precision and the rigor to really do this work well. So actually, I want to invite our panelists and our speakers up to the front. What we're going to do, we wanted to bring in just a panel component so that we can have a chance to do Q&A and really think together. And I invite folks in the online audience as well to be thinking about how do we use this information to move our goals forward? What does this mean for SDG5? And as is common as people are getting settled, always prioritize students for sort of our first round of questions. We'll pass a mic and then we'll read on the chat for folks that have questions there. So let me turn first to our student audience.
Very brief question, but I'm interested if you can just give an overview, and I know this is more complex than you have time for, but when making a measure, how do you do that?
How do you what?
How do you make a measure?
Okay.
I know.
Yeah. I guess so we're gonna sit together for the next 9 weeks, and we're gonna so I'd say the first step to making a measure, and we all do it, but I would say you have to have real clarity on the construct or the concept you want to measure. Typically, when you make a measure, you'll have a survey. Let's say you're going to make a survey, and I'm going to then hand off to you guys because you've just really constructed these new measures. But typically what happens is you have some reason that you want to bring this construct in. Sometimes, you know, a lot of times it's qualitative, but a lot of times it can be quantitative, where your previous survey gave you some insight, but you don't understand the mechanism of associations. So then you'll have the construct. Theory could also guide it. Once you have that work, you often will go in and you'll do formative research with communities that are affected by the issue. And stakeholders can be a variety of types of stakeholders. And then you try to kind of hone in. Then you will typically like ask, so you try to hone in on like maybe like what are some of the key elements of that construct that you think are strong enough that you could kind of make a statement or a question about that could be understood. And you'll typically want to have multiple items, because you're going to want to just multiple items make a more robust measure. Then you get experts that are, you know, sometimes scientific experts as well as other people from the field, and you kind of do the pieces to have these items. Now I'm going to hand off to them, because they'll tell you maybe the next steps after that.
Thank you so much for the question. I'm kind of thinking where to start off on that, but after, you know, I think I can follow up on the part on the validity and the reliability later on, right? Once you have the measure and created all that based on existing data, and the next step is, of course, to compare this. How does this measure up, you know, to the existing measure? What could be improved? Insights from qualitative, you know, definitely. Even I'm a demographer working with quantitative data mostly, but I'm a huge fan of qualitative work, and then we draw lots of inspiration from that. You know, Michele, you know, can speak more to that probably. But so it's a process, like Anita was mentioning. You know, this constant testing, retesting new data, using all of that. I mean, I guess there's never the end to that, right?
There's something in the on the Emerge website.
Yes.
We call it the 10 steps. We call it the 10 steps to creating a measure or adopting a measure. So you can, that's like kind of a cheat sheet, and then it'll like walk you through it. So not a green question. That's
Well, thank you.
That's the way people should do things. That is not the way many things do happen.
Awesome. So I see one hand here, and then we'll go to the back.
Okay. Thank you, Dr. Chen, for your sharing. It was so fast, so forgive me if I'm wrong, but according to your findings, I noticed that you know, the gender belief is doing quite well for girls who are like getting the like correct seeing the mother do, but can you share why it's like quite different between boys and girls? Because I believe engaging men and boys in SRHR and GBV is also very important. So yeah.
Yeah, I absolutely agree with that. And thanks for that questions. And I think in the result, right, what we're basically finding, this is definitely having a stronger effect on the girls compared with the boys. But this is not to say that like the boys are not relevant, right? So there in the literature, there is something about the parent of the same sex tend to influence children of the same sex more than the other. And in this project, we're focusing on the woman. We're limited, you know, in terms of empowerment measure. It's all on the woman, but we really need to look at the fathers as well. So this is something I feel like that's a big piece that's kind of left out from this study. By focusing on the mother and by, you know, finding that we don't have that much an effect on the boys, but a lot is unsaid, right? So this is definitely not meant to say that the boys are irrelevant and the fathers are irrelevant. You're absolutely right. We definitely, to understand women's empowerment and girls' empowerment and all that, men have to be in the picture. So I absolutely agree with you. Yeah.
I know we've got one question in the back, and then we'll turn to one of our online guests. So please.
Yeah, so abortion is not legal in Bangladesh. So how did you explore those centers? Were they exclusively for menstrual regulation? That's what they call it, or?
That's right.
Okay.
That's right. Yeah, which it is, the same thing. So, and, you know, and a lot of these were, right, where it's still, it's, you know, medication abortion, it's not, you know, DNC. So, but yeah, yes, in India and Bangladesh, right, it's referred to as.
These centers were exclusively for menstrual regulation, or they offered other health services as well?
It was focused, these are sort of quasi-government clinics that are part of hospitals that are exclusively for women seeking menstrual regulation.
No, I'm not seeing that question. Okay, so I want to turn quickly and thank you, Khadija, for chiming in on our chat. She's one of our doctoral students and is talking about when it comes to validating measures and generating change, topics like reproductive coercion and empowerment can be contentious. How have you navigated situations in which specific questions are considered appropriate? Great question. Thanks, Khadija.
You're asking the appropriateness of certain questions. So, I mean, yes, so let's say something, you know, reproductive coercion or IPV. There are places where abortion is absolutely, you know, taboo on every level, and we don't then obviously ask about that. There are certain, sometimes we there are certain norms in certain places, such as you know, if we want to get into South Asia around like son preference or daughter reversion, and you know, that's very relevant there, but it's not relevant in many parts of Africa. So, you know, we wouldn't ask the questions there. But you want to add?
No, I think that's right. I mean, sometimes you have to just so that's one of the reasons when we talked about the 10 steps on emerge, we talk about creating and adapting, because there can be great measures out there, but you have to adapt it for your population. You can't always. So how do you maintain the integrity of the original measure, but allow some wiggle room to be able to make it meaningful or understood by the local population, certainly not to offend or harm anyone. So in those cases, I think probably we all agree, we work with our local, like we would never do anything. I don't think any of us would ever do anything without having partners that guide how we do this. Oh, another thing we do is, I don't think it's gotten mentioned, is the cognitive interviews, right? Like we always do these cognitive interviews before, even if the survey is like, we tested the exact same survey last year, we'll like do a cognitive interview where we just run the survey with a few people to start, and any questions that we're not sure about in particular, we'll just like ask them, you know, how did they understand the question? Did they have any concerns about it? We'll kind of go through that. I think those are.
Just very quickly, that I think something that's very relevant for this group is norms are really critical. So when you're asking a question about, did this happen? Did this happen? Did this happen? Maybe, you know, it can be reasonably clear across populations, regardless of norms. But when you ask around things like sexual violence or even reproductive coercion, where there's an aspect of that that's saying, this is against your will. In many populations, right, where there isn't necessarily a critical consciousness of that, I have any right to that, to have any will, to have any decision-making power, you know, around sex, like that is something totally in somebody else's control. You often get very low reports of things like sexual violence. It doesn't mean it's not happening. So anyway, right, the norms, you know, of around among the population are really critical for a lot of these things.
Yeah. I'm mindful of time, and I think we could probably continue this discussion all day, but on that last point, I really also feel like this is just the value of emerge is as well, just to really make a plug for that, because, you know, maintaining the integrity and also seeing how it performs given the adaptations that are necessary. And so together, collectively as this community, we're able to keep pushing the envelope forward, but stay in touch about how these measurements are performing and shifting over context and time. So I just think that's a very nice ending point for all of us gathered today. I want to do, I know we've got another class coming in, so I think what we'll do is just please join me in giving a final round of applause for our incredibly distinguished panelists. So much.